Welcome to 5 Minute School. In today's video we're going to be talking about plantar fasciitis. This is a disorder of the plantar fascia, which is the connective tissue which supports the arch of the foot. Although the cause of plantar fasciitis isn't clear, the risk factors involved are excessive exercise like from running, obesity and long periods of standing up. Other risk factors include those with high arches of the feet, tight Achilles tendon, or those who have flat feet and tend to roll them inwards when walking or running. They are also susceptible. The treatment of plantar fasciitis is usually non-surgical, and we start to see improvement within 6 months with continued rest, elimination of risk factors, so reducing exercise or losing weight, and management with massage, heat, ice, and some actually take non-steroid anti-inflammatory drugs for the management, but this isn't always going to be effective. If the treatment doesn't work, then extracorporeal shockwave therapy is considered, where it's expected to have pain relief up to a year. This is a procedure where shockwaves are passed through the skin to the injured part of the foot. The shockwaves are mechanical and they are not electric shockwaves. They are audible, low-energy sound waves which work by increasing blood flow to the injured area. This helps to speed up the body's healing processes. Other ways of treatment and management can be with corticosteroid injections. However, it's not considered to be a long-term solution. And the last resort, if there is no resolve from any of the above methods of treatment, we have the surgical approach, which is plantar fasciotomy. And this is where the plantar fascia is cut in areas to relieve tension.